So simple answer is yes, we absolutely overlook it in haematology, and it's really become a pet topic of mine as I've become truly interested in the power of food as medicine. Food is medicine, and we don't pay it its due attention. And I think, when we think about both sustainable healthcare and improving outcomes for our patients, and giving them the knowledge and skills to take back control of their own health, food, what we eat, nutrition plays such an important part. And I think for haematology, the areas that I think that we could really benefit by putting the evidence into practice is by supporting people to reduce their burden of chronic conditions. In my lymphoma clinics, for example, people often or normally also have other conditions like high blood pressure, cardiovascular disease, type 2 diabetes, all of which limit the way that I can potentially treat my patients. And these conditions are eminently preventable by putting in good nutrition practice, but also paying attention to other lifestyle factors like physical activity, mental health and well-being, which is also going to be covered in my session. In addition, we are increasingly realizing that the health of the gut microbiome during cancer treatment can predict somebody's response to anti-cancer treatments, as well as how long they may remain in remission, and even in some studies, their overall survival. And I can promise you that we do not pay enough attention to the health of our gut microbiome in our patients, often doing harm through the treatments we are giving, plus the burden of antimicrobial treatments we deliver as well. And when we think about what we need to do to harness the power of the gut microbiome, it's a healthy diet centered around a variety of plant foods, polyphenol-rich foods, fermented foods, and high-fiber diets. And we know that most of our general population in the UK are not consuming that type of diet. And then what's really exciting as well, because I guess as a hospital doctor, like my colleagues, we don't necessarily have the ability to impact sort of upstream determinants of health. But when we're seeing people with cancer and they've finished their treatment, we have the ability to support them to improve their quality of life and survival following a cancer treatment by implementing really high quality nutritional advice along with other lifestyle factors. And similarly to sort of sustainability aspects, our patients are really hungry for this information. I sort of got interested in diet and lifestyle because that's what my patients want to know. What shall I eat? What can I do? What can I do this? And, I didn't feel adequate at the time. And so I've spent a few years getting the right qualifications, and lucky enough to have the opportunity to share some of this evidence at this year's conference.